Hi, I'm Molly Sullivan with Golfers MD, your source for all your golf health, fitness, and injury information. Golfers are prone to lower back strains, as golf involves unilateral twisting motions. The pain and injury can often cause golfers limited mobility and misplay. Today we visit with Dr. Rhonda Bacheron, sports medicine orthopedic surgeon and athletic trainer, to tell us more about lower back strains.
A low back strain is an injury to the lower back where the tendons get pulled and then the patient or the athlete will feel pain in the lower back or tightness or spasticity. You can get a lower back strain from several reasons. It could happen from being tight in other areas and having biomechanical issues in other areas such as the lower legs, hamstrings, hips that will predispose the back to get tight. You could have a traumatic injury where there's actual event that then leads to the back being injured, or sometimes there could be a other injury in another area that then creates stiffness in the back as the back is being compromised to compensate for the other injury. The symptoms usually are spasticity, pain that varies from sharp to a dull ache in the lower back. At times, a more significant injury could be represented by pain going into the buttock region or down into the leg, and that would warrant pursuing an MRI to rule out a pinched nerve or herniated disc. Treatment for a lower back strain usually involves an anti-inflammatory medication to bring down the inflammation of the strain. At times, we may use a muscle relaxant to help the spasticity. The most imperative part of a low back strain is addressing the biomechanical issues that may have led for the back to get tight and injured. An athlete can usually play with a lower back strain if they can proceed with all the activities that they need to perform with their sport.
A lot of structures in the low back that can be damaged or injured. Low back strain could take as little as 2 weeks to recover from with just rest. However, if it is a nagging problem, a chronic problem, you really need to look at strengthening the trunk and hip. Those muscle groups help to reduce those really aggressive rotational forces that most athletes deal with on a regular basis, especially golfers. It's not a matter of if you get low back problems, it's a matter of when. So the strengthening of those muscle groups could take as long as 6 to 8 weeks.
Be sure to keep these tips in mind when you prepare for sports and want to stay strong and healthy. I'm Molly Sullivan with GolfersMD.com. Remember, at GolfersMD, health equals performance.